Hello, thank you for joining us. I'm going to be doing a massage for the lovely Julia today, and we're going to be doing a pec and neck massage with plenty of deep tissue, and I'm going to go ahead and dive right in. So when I'm working on a new person, I'm definitely aware of moving a little bit slower and just, being really intentional about like the way that I'm working. And especially if it's someone new to massage, I'll, just really take my time. Really like to walk the shoulders, helps to relax the neck and the pecs a little bit. And sometimes people, they have lifted shoulders without even really realizing it. You get into a habit of holding the shoulders up by the ears. And I'm just gonna stretch this neck a little bit. And usually when I'm geared more towards deep tissue in the neck, I like to start with some deep tissue in the pec major. Kind of helps the neck to relax a little bit. And when I'm doing a massage, I'm always thinking of often the pain that my client's feeling is referral pain. So it's kind of the root of it is somewhere surprising that they don't really think of. So it's kind of like a treasure hunt when you're doing a massage. And making sure that as I work my way into this pec major, I'm starting at the origin to get a nice true release. And I'm not starting with max pressure here. And it's really hard to get max pressure with this technique that I'm using anyway. The pec major is a lot easier to work on men for obvious reasons. But can still do some really good work here. And I find that coming from this angle, focusing on trigger point work is really the most effective. Just finding those little pockets of tissue, because you're not running along with the fiber in the same direction. So it's an opportunity to really be sensitive to trigger points. And always with, for some reason, with the, pectoral work and also the neck work, it requires a good bit of concentration. So I just find that I need to be careful of holding my breath when I'm concentrating, because kind of indirectly telling my client to hold their breath, which isn't the best. And I'm going to go in with some stacked hands to offer a little bit more pressure as Julia is comfortable with it. So just kind of following her cues. If she starts to furrow her brow or lift her shoulders, there's all kinds of little clues that I can pay attention to. Maybe going too deep. I use stacked hands whenever I can, just to save my hands, and stacked thumbs are really nice too if you want to get a little more specific. And if I wanted to go max deep, I would use my elbow, but I'm not gonna go that deep today. This is the first time that I have actually worked on Julia. And the great thing about stacked hands is if one hand gets tired, you can swap hands. And so when I do trigger point, I don't just abruptly lift my fingers. I kind of just try to make it one fluid motion. And always when you want to introduce more pressure, you want to move in towards the body, no matter what area you're working on. And just always trying to weave my movements together into one kind of cohesive thing. So lifting my hands as little as possible. I'm going to go ahead and swap out my hands because my left hand's getting tired. And this is also a great place to kind of look for clues as far as what side might be tighter in the neck. How the upper back might be carrying the neck, especially the upper traps. And it's really usually when you're closer to the origin of this muscle, you can find a good bit of trigger points in there. And I'm always finding just what feels the most comfortable as far as the angle that I need to be working. So if I were to try and do deep tissue, not at this angle, it would be a lot harder. And when I'm doing trigger point, if I'm working with an area that's really stubborn, sometimes I'll, hold for maybe 3 seconds and then revisit. I find that sometimes that's a little more tolerable than holding for longer. And starting to work my way into the neck. And I usually follow the same routine more or less when I'm focusing on the neck muscle. So I usually start with the upper trap and kind of work my way up the back side of the neck. Just really helps the SEM to relax a little bit more and really just encouraging these upper traps to relax. And this is a great spot for a nice pincer grasp. I'm just gonna bring my hands under, and this is great for increasing circulation in the upper traps and the levator. And I wouldn't try this on someone with a low pain tolerance. They really don't like deep tissue. It's probably not the best thing to do. And you just want to be careful that you're not pinching skin. You really want to stay on the muscle belly. I might do this a couple of times. So every time that I release that pressure, this fresh blood moves into these different muscles. Right now I'm doing some soft tissue work to just warm everything up, and I'm also scanning from right to left, just with my fingers. So it feels like the left side might be a little bit tighter. And I'm just focusing on how to budget my time. I'd say that's one of the best boundaries that you can have as a massage therapist, is to really honor time limits. I love working on this occipital ridge. It just provides so much relief to the brain, really. Just can feel that release all the way up into the forehead and the temples. And I'd like to take a minute to thank a few of our patrons: Perry J. McCoy, Evan Hunt Johnson, and Timothy. Thank you guys so much for your support. Really appreciate you. And this area can be really sensitive, so I'm just gradually starting to introduce a little bit more pressure. Because this is my first time working on Julia, I'm not gonna, attempt to go as deep as possible, even though she's used to deep tissue and she's comfortable with it. And don't be afraid to, if you do want to go a little bit deeper, don't be afraid to explore different angles. You can slide your chair around and just find the angle that works best for you as the therapist or body worker. And right now I'm just making sure her head is nice and stable. You introduce a little bit more pressure. I'm definitely going to need to do some work in the suboccipitals after this deeper work. And, it's important to pay attention to the temperament of your client. If I'm working on someone who tends to get a little bit fidgety, sometimes I'll, focus on a little more movement, like just little circles. It just kind of depends. And always just being careful not to overwork my thumb. So this is nothing fancy, but I find it's a really nice way to work the suboccipitals, just with that upward stroke. I'm just making sure that Julia's head is nice and stable as I kind of move in towards her spine with that movement. And moving on to this SEM muscle, along with the upper trap, I kind of like to combine the two when I can. It's really nice when you can remind muscles to work together instead of against each other. And part of what I'm doing is just making sure that I know exactly what I'm working on and I can go in with that confidence before I go in with my thumb, so I'm not wasting any energy. And the hardest thing sometimes with this technique is just using restraint, because it's such a sensitive area. You can go too deep pretty fast. So just really kind of holding back a little bit. But not being like overly tentative, because that doesn't feel good. And this is another area where you're going to find some really good trigger points. But just using the right amount of pressure. And same thing when I do this trigger point work, I'm holding and kind of bringing that stroke down. So I've never liked it when trigger point work feels choppy and disjointed. Like when you just press and lift, it doesn't really feel as good. Focusing a little bit on these scalene muscles, definitely including them, but working a little more broadly. And don't feel like you have to, use a fancy technique to do a really good job with neck massage. Sometimes the simplest technique is the most effective and it's going to feel the best. Again, just really including a nice broad stroke covering all these different muscles, ending the suboccipitals into that occipital ridge. And same routine on the left. Always when I move, when I change sides, I kind of give myself just a second to take a breath and like relax my shoulders, kind of check in. I've been doing deeper neck work this way for years, and so it's not hard for me to remember like the routine. But if you don't remember what you did on one side exactly, don't worry about it. Just stay focused on working as organically as possible and really just seeing how the massage evolves. I'd say the least satisfying massages I've gotten have been where they feel like just generic and really mechanical. You really want to customize your massage to what your client needs, and everybody's different. And for some reason, this left side does feel fairly tight. So if I were doing, my typical like 60-minute massage with a new client, I would communicate anything that I find to them. And I would definitely encourage Julia to get more work, especially on the left side of her neck. And I might explore different questions I could ask, like why that's happening. And this area is a little bit inflamed, which is fairly normal. But excessive inflammation is definitely a contraindication to any type of massage sometimes, especially deep tissue. But just an acute amount is pretty normal. Nothing to shy away from. And just, this is like the best angle for getting into the suboccipitals because I can move in towards Julia's spine. And it's a lot harder to do that with a downward stroke. Just starting to work a little bit more locally. And this is a really fun approach to neck work if you're someone that really likes to work in a detailed way, or if you're wanting to learn how to work in a more detailed way. And again, just making sure that I know exactly what I'm doing before I use my thumbs. So And this might sound corny, but just make sure that you're, staying grounded in your own body and really breathing through your feet. So it's really easy to kind of lose awareness of your own body when you're doing massage, because it's just requires a good bit of concentration. And you can explore, don't be afraid to explore different angles. So like when you're working on this SEM, you can kind of slide over, see how that feels. Just see what feels the best. And trust it if it feels like easier. I feel like sometimes as massage therapists, we feel like the harder it is, the better it is or something, but it's not true. And I'm starting to go in with some trigger point work. So I would definitely encourage Julia to just balance. I feel like her upper trap is fairly tight and it's putting a lot of pressure on her neck muscles. So just anything to kind of open up those shoulders and balance anything that she's doing to just put more pressure on this neck. I recommend yoga to pretty much everybody. It's just a great way to help the body. And really not doing anything too specific along these scalene muscles, just a nice downward, upward stroke, helping them to lengthen a little bit, clearing up a little bit of congestion in there. And sometimes if you're feeling like you're not quite, you don't have the tautness that you want in either the SEM or the scalenes, you can just explore kind of shifting, the head slightly, and it can make a huge difference. And after I work on the right and the left, I like to just include both sides, kind of tie it all together. And I'm thinking, since I have like the perfect amount of oil on my hands, I think I'm going to go ahead and do a little bit of scalp and face just to top it all off. And whenever I do scalp massage, I just make sure that I'm not pulling the hair. So I might just scooch the hair up a little bit. Sometimes doing massage, if you're new to it, can feel a little intimidating, but just know that like anything you do along the scalp is going to feel really, really nice. Just doing little circles, just offering a little bit of friction, stimulating all these nerve endings. I like to use a nice firm pressure when I'm doing scalp. I've had massages where people use a really light touch, and that can feel really nice too. Just little circles. And if I were to try and do this without the support of the table, so I'm actually leaning up against it, it would be 100 times harder if my hands were lifted. So just really letting myself be supported. I did have a client one time who he would often want an hour of scalp, which I was happy to do, but it does seem like a lot, a whole hour of scalp. But some people love it that much. If you're working on a client who is stressed or scattered, just pressing in the middle of the scalp, I'm just pressing about half an inch apart, just working my way down, can help kind of center and balance. Usually do that a few times. Don't expect yourself to be perfect as a massage therapist. If you forget something or whatever, just kind of move on to the next thing. I know a lot of massage therapists can be kind of perfectionists a little bit. And just starting to work my way along the hairline to this frontalis muscle. If you're going to massage one area of the face, I would say the forehead is the most important. And I would encourage anybody to just kind of explore and have fun here. So it's another place where pretty much anything you do is going to feel really nice. You can walk those thumbs up. Focusing a lot on these temples. And I do like to include a little bit of jaw work. So our face massage today is pretty brief, but just kind of encouraging her jaw to relax, take some pressure off of that forehead and those temples. And I would definitely check in. I would never do this if I'm working on a woman on her lunch break and her makeup looks just perfect. I definitely wouldn't just dive into face massage. Definitely want to ask and make sure that's what they want. Really important to get under the chin. You do need to be careful of, you want to stay on muscle here. There's some really important glands in the neck that you don't want to put a lot of pressure on. So I wouldn't recommend doing this unless you have a pretty good idea what you're doing. And I really like this move to end. It just feels really calming. And that is it for today. Thank you for joining us today, guys. I hope that you enjoyed today's video. If you did benefit from what you saw in this video, we have a lot of great content on Patreon, and it's a chance to gain access to exclusive content, and I hope to see you there.
If you enjoy these videos, please join us at psychetruthpatrons.com for dozens of exclusive videos and premium programs. We have over 1,000 videos you won't find on YouTube, such as modeling and fashion hauls, exclusive massage videos, ASMR, behind the scenes, bloopers, and much more. It's a great way to help us keep the cameras rolling so we can continue making the content you love. Patrons will get 2 to 3 new exclusive videos each week, so I hope you'll consider joining our Patreon family today. Just visit psychetruthpatrons.com.